Hi everyone, it's a pleasure for me to tell you what we've done as Foundation Care for Brittlebones in the year 2021. And I'd like to say you right up front, we hope you're going to support our work also for the next year with a little donation. I'm going to provide the link later on for it. But what is it that we've done? So we are actually in a position where we've worked incredibly hard. And however, from a fundraising point of view, this year has been quite unsuccessful. So any help that you can give to continue our work in the next years to come would be hugely appreciated. Foundation Care for Brittlebones exists now for 10 years. And in many ways, our work has matured and has become stronger than it has ever been. And so here are a couple of those examples. Let me start with our flagship project, Key4OI. Key4OI is the way to measure outcomes in people with OI. And why is that so important? Well, it's so important because people have all kinds of different needs that are very, very different. And as long as we measure consistently what medication or orthopedic treatment or other treatment on physical health or psychological help does to people with OI, we will not know how we can improve things. The simple truth is what gets measured gets done. And you cannot improve unless you measure and you really know how things have improved or not. And that's why consistent outcome measures are super important. So what you're seeing here is being implemented in 5 different countries. In China, in Hong Kong, Shenzhen, then also in the Netherlands in 2 different hospitals at the moment, in Norway, in the US and in Canada. And we're incredibly proud that we will be launching this globally for everyone who'd like at no cost. We are not receiving any funding for this, and hopefully also in local languages so that it's easy for everyone to start collecting the same information and data when treating people with OI for the benefit of the individual patients as well as the whole. So this actually has not just been created with visuals, but it's also been published in the Orphanet Journal of Rare Diseases, which I am sharing you right here. So that's an article that has been published in January this year. Talking about publications, there was also a publication in the in this magazine here. Let me get out of the way. You can see the roadmap article, which started in 2019 at the conference Quality of Life for OI and under the leadership of Ralf Zakkers and many incredibly dedicated people from a kind of global coalition of orthopedic surgeons and rehabilitation physicians and occupational therapists. We've created this holistic view on how to support the physical well-being and surgery and follow-up for people with OI. I really think a very fundamental piece of work. And then celebrating a 3rd publication which has come forth through our work, which is this one. Actually, this one here. It is a publication done by Antonella Lomaro and her team about eating, breathing, and sleeping with osteogenesis imperfecta. The ASITOI patient organization Italy has enabled that together with Care for Brittlebones, a wonderful collaboration which we're very grateful for. And also, obviously, the whole team has been super dedicated to clarify what it means to breathe well, to eat well, to sleep well with osteogenesis imperfecta for people with a severe form of OI. And that leads me to another research project. I just turn this one off for a second. So breathing has become also for us a very important topic. The OIF has been very much into this topic for, I think, slightly longer, and we benefit from what they know and the urgency they're creating. So tribute to them. So we have looked into 3 different areas. Lung is one of them, breathing is one of them, but also hearing and also the teeth and jaw area. And so in 2021, I've personally coordinated 9 different focus groups that were bringing together the patient perspective around those 3 topics, and also led 60 different meetings of groups of experts in those 3 areas to come together, to think together on how, again, to assess the outcomes in those 3 areas consistently, so that eventually that will lead to better research and better understanding of this area. So that is the so-called Key4i Plus work that will be published next year. And hopefully you'll also find it interesting to see those results next year at the conference. Quality of life for OI. And that's another topic, what we've done. In 2021, we have worked towards having a face-to-face event, which unfortunately needed to be cancelled. So it's now a virtual event of 1 day on the 12th of February, which is something that hopefully you will have all in your agenda. Then there is 2 networks that have worked this year under our support and supervision and coordination, so to speak, around the psychosocial health and well-being of people with OI. We've done an expertise finder survey, and we've looked at that. What does it mean? What do we hear from those experts that actually deal a lot with psychosocial health? So that will be reported out at the conference as well, but we have the findings already. And there's the big network of physical well-being for OI, which is a top priority area for us and has received great attention in the area of adolescent health and adult health, thanks to the leadership of Kathleen Montpetit, Lena Landewecke, and Marjolein Verhoef. They have been doing a physical well-being survey. 270 people have responded to it, and we're far advanced in analyzing that. And we will finish that in January, just in time to make sure we give you the latest on the conference on the 12th of February as well from that survey. I'd like to finish with something that's very small and something that's very big. So we've definitely done a lot of things that are to the human level, because we think it's not just enough to do research for the library. We really want to make a difference in the lives of people with OI. And on Wishbone Day, we have organized a worldwide Zoom call of 13 hours, bringing together artists and creative people from all around the world to celebrate that there is something like OI identity, special lives, unique lives that really are well to be recognized for what they've achieved. It's important not just to talk about the hardship, but also about the beautiful creative side that comes out of it. And I still smile thinking of that. And we've organized a couple of peer support meetings and networks, for example, of young parents of children with OI. And these are small meetings where people are crying and they are supporting each other in marvelous ways. And that can all be done virtually. We want to do much more of that in 2022 through the Foundation Care4BrittleBones, which is a platform that is really geared to collaboration in a much, much better way than any social media can do. So that's the small part. So the really tangible making a difference part. But then there's also the really big opportunities that we're after, the CRISPR-Cas and the other big innovative technologies that have come available. We are kind of linking with our little finger into all of those technologies. We have some projects going on in this area, and we really are keen to make sure the researchers are working together on accelerating some of the opportunities and also mitigating some of the difficulties that they all have. For example, accessing mouse models and certain technologies that are very costly. And that brings me to why you are needed. Our income in Care4BrittleBones has reduced from something far beyond 400,000 to below 100,000 in the last 1 or 2 years. It's now 2 years due to Corona, the problem that we haven't been able to do any fundraising events. Please help to support our work. We really appreciate that. And you can find a donation link somewhere around this video. Thank you so much for your attention, and hope for a happy and healthy year 2022 for all of us.